Good day, global citizens. Welcome to another episode of Dr. Fajembola'S Opinion. Today, I have a colleague in the field of public health who is here to discuss osteoporosis in Nigeria, and I'm glad we have prepared for you to discuss and to know everything, the nitty-gritty on osteoporosis to the best of our capacity and the best of our knowledge and expertise. Please join me to welcome Mr. Aroyehun Kayode. I'm so sorry. I usually get confused sometimes with the with the titles. So thank you so much. I read on your profile, on your LinkedIn, you're an aspiring PhD researcher, right?
Yes, ma'am. Yes, ma'am.
Thank you so much, sir. If you're using math for me, I also use that for you. Yes, sir. um it's actually great. I'm actually inspired. Please go for it, whether in Nigeria or outside Nigeria, wherever you want to do your PhD. I always want people around me to go for that. I want people around me to be better. I celebrate growth a lot. So please, if you're aspiring to go for your PhD, whatever, please go for it. Go for postdoc, be an emeritus professor if that's what you want. I'm so I that's what I want for people actually. So good luck on your future journey of becoming a PhD scholar. Mr. Aroyehun, we normally look at what people are saying about our topic of discussion on social media. But before then, let me give our audience a biography of our guest researcher for today. Mr. Aroyehun Kayode Simon-Peter is a dedicated and results-driven public health professional from Nigeria, deeply passionate about health promotion, education, and advocacy. With a strong academic foundation and diverse hands-on experience, he has consistently sought to drive impactful public health initiatives in various communities. Mr. Kayode's academic journey reflects a focused commitment to the field of public health. He earned a Master of Public Health with a specialization in health promotion and education from the prestigious University of Ibadan between 2022 and 2024. By the way, University of Ibadan is prestigious. Let's continue. Prior to his master's degree, he obtained a Bachelor of Science in Education, in Health Education from Adekunle Ajasin University, Akungba-Akoko, from 2015 to 2019. Mr. Kayode's career is marked by a series of roles that have allowed him to apply his academic knowledge in practical settings. Currently, he serves as a health education officer at the Primary Health Care Center in Meiran, Lagos, where he develops and delivers health education sessions and assists in the planning and implementation of public health campaigns. As a researcher, Mr. Aroyehun Kayode has contributed to the body of knowledge in public health. He's currently working on multiple researches. He has co-authored publications on topics critical to Nigeria's health landscape. Mr. Kayode is a well-rounded public health professional poised to make significant contributions to the health and well-being of communities. Beautiful, beautiful biography, Mr. Kayode. I look forward to you becoming Dr. Kayode, and if you're interested, Professor Kayode, God willing. Now, let's move to what are people saying about osteoporosis, our topic of discussion for today. The first is from Professor Dr. Sanjeev Bagai. I guess it's not the first time I'm seeing it, checking a tweet from Prof. Where he said multi-omic characterization of the long-term sequelae of SARS survivors. Fatigue was the most common symptom in SARS survivors 18 years after discharge, with osteoporosis and necrosis of femoral head being the main sequel. Another tweet is from Lola, where she said there is not a single shred of evidence anywhere that says if a female takes dangerous levels of testosterone, it will cure depression. You will end up with possible osteoporosis and a whole host of lifelong irreversible health issues, though you have no clinical need for testosterone. Being GNC does not need medicating. I think this is a case of people abusing medications or abusing treatments for whatever reason they choose to. The last tweet is from Joshua Chapman, where he said, "A strong body, particularly grip strength, is an insurance policy for life. Resistance training can protect you from sarcopenia and osteoporosis. Lift now for the 80-year-old version of you who can still travel and make new memories." So this tweet is about exercising. Based on use exercising and preparing yourself for the later life if at all you get there. So let's dive into the discussion now. Mr. Aroyehun, today we're looking at osteoporosis, and this is a condition that is well observed in postmenopausal women, although it occurs in men and young women too, and even children, indicating that it's across all age groups. You understand, depending on the health condition of an individual. So we during when I was reading your paper, I was coming across osteoclasts, osteoblasts, and for just to make it life easier, which because I don't know if you might use it in your discussion, when you come about osteo, and this to our audience, osteo is bone. How I made it easy for myself as when I was a medical student. Osteo, but looking at porosis, porous bone is osteo. So that's osteoporosis, bone, porous bone. But where osteoclasts, that is the balance that we see in bone formation and bone resorption. That's where osteoclasts and osteoblasts come in. I made it easy for myself as a when I was in medical school was break. B stands for break. So osteoblasts, that's breaking down. I mean, osteoblasts, that is build up. I mean, build up of bone cells. Osteoclasts, that is breaking down of bone cells. I hope I got the analogy right. So osteoclasts, like clasts, breakdown. Class, I don't know what other cuts. Let me put it that way. C for cut. So osteoclasts, cutting down of brain cells. Osteoblasts, build up of brain. I say brain. Build up of bone. Build up of bone cells. So balance between osteoblasts and osteoclasts. That is what makes my bone. That's what makes my bone a healthy bone or a porous bone. That's what makes our guest researcher his bone a healthy bone, or your bone a healthy bone or a porous bone. With other factors that might come in, whether pre-existing medical conditions, the food you eat, a drug you are using, you understand. So basically, I want our audience to get that difference between osteoclasts and osteoblasts. So Mr. Aroyehun, I said I don't know if you are going to use the osteoclast because it's the balance between these two that leads to osteoporosis. So, Mr. Aroyehun, what are three things about osteoporosis in women you want our audience to know?
Thank you very much for inviting me to your platform. It's an honor. The first thing that the people need to know about osteoporosis is that osteoporosis is simply put, just a condition whereby the bone health is compromised. So it's actually a public health issue. The statistics are there to show that it's a public health issue. So I think it's something that most people should have adequate knowledge and awareness about. So one of these things that people should know about osteoporosis that is more common in women, and we have to say specifically after menopause, postmenopausal women, it's more common among those women. they are more predisposed to osteoporosis. And it's also a silent disease because there are cases whereby people ask that how do I know I'm at risk for osteoporosis? How do I know I'm at risk? The silent disease is something that needs detailed monitoring, specific monitoring. And it's most women don't even know they have it until it happens. That's how funny osteoporosis can be sometimes. And another thing that they need to know, people need to know, is that it is very preventable and manageable. So it's something that is very preventable and manageable through adequate calcium. They talk about diets and lifestyle modifications like physical activity, exercises, and avoiding risk behavior like smoking and alcohol abuse. So it's very preventable. These are the three key things that I think people should know about osteoporosis.
Okay, thank you so much for that brief explanation, Mr. Rayon. And that's what I love when I say three things: points, and that's how you did it. Osteoporotic fractures. From the paper, from your paper. You are no doubt also like osteoporotic fractures are among the leading causes of disability in elderly individuals. Pre-disease lifestyles. Pre-disease lifestyles was mentioned. This was a common phrase in the paper. Are there other disease lifestyles that we don't know about? So when you
Okay,
say
so
pre, people will say, okay, are there other disease lifestyles?
so let me explain it in a way that's very easier for everyone to understand. So when we use the word pre, that was not before the onset of a disease. So when we use the word post, it's after the onset of a disease. So when we're talking about pre-disease lifestyle, we're talking about the lifestyle before anybody becomes sufferers of osteoporosis. So this has to do with their habits, their overall lifestyle, their habits from their diets to the lifestyle. Maybe they live sedentary lifestyle, there's poor exercise, the individual smoke. Those are the disease lifestyle before. So the lifestyle before they became sufferers of osteoporosis. Those are the disease lifestyle before the onset of osteoporosis. But when we talk about the disease lifestyle, these are the behavior during disease. Let's say, for instance, now like ignoring treatments. Probably the individual have been diagnosed with osteoporosis already, and then he or she ignores treatment. Then the person has tendency to suffer more damage of osteoporosis because the bone health will keep compromising if the person does not adhere to treatment and keeps going back to the disease that predisposes he or she to osteoporosis. And now we want to talk about the post-disease lifestyle. That is how the person manage his or her life after being diagnosed of osteoporosis, which is still boils down to the actual trying to manage the actual risk factor and prevent the actual lifestyle that predisposes one to osteoporosis, like diets, like regular exercise, avoiding smoking, and then alcohol abuse. All those things are what um, predisposes an individual to osteoporosis. So the disease lifestyle are the lifestyles before the onset of osteoporosis. The disease lifestyle, the lifestyle during or after the individual have been diagnosed of osteoporosis. While the post-disease lifestyle are the lifestyles after the diagnosis of osteoporosis. That's where I can just put it simply for everyone.
Thank you so much, Mr. Rayon, actually, for that elaborate explanation. I'm sure our audience understand what pre-disease lifestyle is before the disease. And pre-disease lifestyle is not only to osteoporosis. You have pre-disease lifestyle in you have malaria in pre-disease lifestyle. If you have hepatic liver disease, your pre-disease lifestyle before you add the liver disease. If you develop, how will I put it? Which other stuff again? If you develop tuberculosis, HIV, what was your lifestyle before you were diagnosed? So before your diagnosis, that's pre-disease lifestyle. After your management and stuff, that's post-disease lifestyle. Thank you so much, Mr. Ray, for explaining that. And I'm emphasizing it's not only to osteoporosis. So and I'm glad we are breaking it down in bits. Mr. Roy, in the paper, you add a mind map. Can you paint us a picture of predisposing factors to osteoporosis?
Okay, thank you very much. So, just like we all know, generally, according to studies, The general predisposing factors for osteoporosis boils down to diet, um, physical inactivity, smoking, and then alcohol abuse. Then we have other little factors that can predispose one to like lifestyle factors, for instance, maybe like secondary exposure to smoking, sedentary lifestyle, probably due to the kind of workplace, sitting positions. Those are the, like how I put it, they are the minor predisposing factors that connects to the major ones. So, but from our study, we carried out a study in Akungba-Akoko among three postmenopausal women who were medically diagnosed sufferers of osteoporosis. So, we after conducting interview for them, in-depth interview, because we used a quantitative approach, we discovered that most of the risk factors that predisposes one to osteoporosis, they were also like victim of those risk factors. So we created a mind map around the themes of the study, and we found out three major themes for the study, which is the personal health history, then personal history of other illness, and then personal history of fracture. So in the personal health history, we talk about history of maybe they had previous fractures, they had previous illness, then those things predisposes them to osteoporosis. And some studies have shown that when an individual have like recurring fracture, that such individual are predisposed to osteoporosis. And about 2-3 of the participants had similar issue. We also talk about history of people that have underlying health issues already. So some of them said they had underlying health issues like rheumatism, arthritis, which also have predisposed them to osteoporosis. And then we talk about diet, their lifestyle was also one of the major themes in the study. The diet, and then we talk about the the lifestyle where they live, because most of them reported that they stay around people that smoked, even though they didn't smoke directly, so they were exposed to secondhand smoking. They talk about abuse of alcohol because they were ignorant of the damage and the health consequences of those things. So basically, the overall theme of the study shows that all all the evidences of the risk factors that exposes individuals to osteoporosis, the participants were victims of such risk factors, and they were not aware of the health implications of their previous lifestyle. So I think the results establish the fact that health education and health promotion is very crucial. At the same time, lifestyle modification is very crucial if we are to win the fight against osteoporosis.
Thank you so much, Mr. Royal, for that, for painting us a mind map of predisposing factors. Um, from the paper, biologically, osteoporosis results from an imbalance between bone resorption and bone absorption. And I believe from the beginning, my explanation of osteoclasts and osteoblasts, and also from your explanation so far, English-speaking people already know what osteoporosis is. Can you describe osteoporosis? What is osteoporosis in pidgin English?
Okay, osteoporosis now when person bone don weak and hollow like sponge. So the person bone no fit carry the body well again. So if any small thing the person fall or the person trip, so the person bone go break easily. So the person bone don weak due to maybe the person lifestyle or the person underlying health conditions. So basically na when na like silent bone compromise. So when person bone don dey weak small, and the person come fall, the person go break easily. So na wetin osteoporosis mean be that.
Thank you so much, Mr. Rayon, for that. Actually, for our English-speaking people, una know sponge wey dey use to wash plates. If you put water inside sponge, wetin go happen? The water go pass through the sponge. And we know soap. I no talk of liquid soap, I talk of hard soap. Now, for example, let's say they use hard soap, they wash plates. and let's say they use sponge, they wash plate, normal sponge, all things be equal. That is an example. Now example of osteoporosis be that sponge wey water fit go through, you see the sponge normally, especially like iron sponge for example, now you go see say e get spaces in between. You go see say spaces dey in between the what are they called, spaces dey in between the sponge, but you see soap, no space dey in between, e dey hard. So na how, na wetin you go call osteoporosis be that. Normal bone, healthy bone na the soap, osteoporosis na the sponge. And na why oyibo man, white people, na why they name am osteoporosis, because pores, osteoporosis, e dey porous. Porous mean air fit enter, na something wey air fit go in and out of am. So porosis na that sponge wey air. So next time when you dey wash plate, or one time when you wan baff, I no know kind of sponge una dey use dey baff. Next time when you wan baff, when you see your sponge, you go know say anytime you see anywhere you see sponge, you go know say this one, okay, osteoporosis. I no dey call anybody sponge with osteoporosis. Before you go through your sponge, you will say na osteoporosis na bad thing. I just dey give example. So example of osteoporosis na your sponge wey dey use wash plate, wey dey use baff. Normal bone na the soap, na the hard soap you dey use baff or you dey use wash your plate. So thank you so much, Mr. Aroyehun, for that. Your paper, it was highlighted that osteoporosis is a public health issue.
Yes.
Before reading your paper, I don't know it's a public health issue. And I'm a medic. And I'm sure, I don't know if there are other medics like me too. Now just imagine people outside the field of health. Not even, I'm talking of people, science, people that are even in the field of science, people that study physics, chemistry. Now imagine people outside the field of health and people outside the field of science. You understand? I'm here not as a I know it all. As we are educating our audience, I'm also educating myself. So from reading your paper, I realized osteoporosis is a public health issue. Mr. Aroyehun, how is osteoporosis a public health issue?
Thank you very much. Osteoporosis, as we know, one of the major reasons why osteoporosis is a public health issue because it leads to disability and dependence. When individuals, especially the aging population, because they are more predisposed to osteoporosis, by the time they have properly or they cannot move properly, then most of them have to depend on some for probably mobility or any like mobility, even in terms of they cannot even earn a living again because most of them they have to remain indoor. So I think one of the major public health issues that osteoporosis is something that we should look into is the issue of disability and dependence, and that dependence also is a strain on the able population because they also have to maybe probably someone that cannot go to the workplace again due to maybe a fracture in the leg and it's not even due to osteoporosis. So that will depend on someone. So he has to work overtime. So that dependence is one major issue that I think osteoporosis is as a public health issue. They talk about the increase in health costs because the issue of rehabilitation, surgeries, and then talking about something like, for instance, now not all individuals can afford the osteoporosis, the management of osteoporosis in terms of the rehabilitation and the continuous care, because it's not easy that you just treat at one time. It has to be managed. So that's another reason why I feel the public health issue. Another reason is that it reduces the overall quality of life. Talking about the issue of dependence, because when the aging population are becoming disabled, the younger population will have to work overtime to so that they can be able to provide for them. So that dependence, I think dependence is one of the major reasons why osteoporosis is a public health issue. They talked about osteoporosis is also under discussed and under diagnosis in low and middle income countries like Nigeria, because most people are not aware they have osteoporosis. So I feel the fact that it's under discussed and under diagnosed is also a public health issue, because some people just be like, what is going on? I have a fracture, it's not healing up, I've gone and due to the poor health education, some might just even visit the herbalist and then it gets worse. So they're not really aware of what osteoporosis is. So I think the fact that it's under diagnosed and under discussed also makes the public health issue. And then Generally talk about the public system. The public system need to promote the early screening and then health education programs at the grassroots community level, because the one of the major place where I feel sector where I feel is a public issue is low and middle income country where they are not even aware that they are sufferers of osteoporosis. So I think that's why osteoporosis is a public health issue. The issue of dependence and disability.
Thank you so much, Mr. Ryan, for highlighting on that, on why osteoporosis is a public health issue in Nigeria, and specifically in Akungba-Akoko, where this research was done. Um, from the paper now, looking into more discussions from the paper, an anterior osteoporotic fracture is likely to significantly enhance the risk of subsequent fractures in the future. Mr. Aroyehun, please can you shed more light on this? How is an anterior osteoporotic fracture? I think you even need to tell us what an anterior osteoporotic fracture is, because that grammar is too much for me and our audience.
I think in a simpler term, I would just say an anterior osteoporosis factor should be like is the first compromise of the bone. That is in the body system, for instance, now the first instance of the bone being compromised. That's the anterior, like the first onset of osteoporosis or the first sign of the bone weakness. So that's like the anterior osteoporosis. Just like for instance, now when someone feels a pain in the back, maybe in the spine, and then after like a month or thereabouts, it feels another pain around that area of the spine. So when they say the statement said, I think he said an anterior osteoporotic fracture is likely to like influence subsequent fractures. So in that, if for instance now, if I have a sitting posture and I feel pain, so I want to adjust my posture to ease myself or for my convenience. But in the process of making myself convenient, I'm already altering another normal body posture. So it's a process by, so that statement just implies that when a particular bone is weak, that weakness in that region or that bone has the ability to influence or to affect another bone. Then that's what they call progression of the bone compromise. So the bone becomes compromised. Like if I'm feeling the pain in my joints, for instance, now, and then in the next 2 months, I discovered that I'm feeling a pain, under pain below my joint. So it means probably when a bone is compromised, it can affect, because I might want to adjust my convenience. So it's just like saying like okay, I want to adjust my posture, but I'm now altering the actual posture of my body to suit my own convenience. So that's what the statement implies. So one bone weakness or damage can lead to subsequent bone fractures or damage.
Okay, thank you so much for that, Mr. Aroyan, for breaking down the osteoporotic fracture and how it leads to other fractures. Also, from the paper, you and your authors highlighted all participants reported that they eat pounded yam as often as possible. I'm from Ekiti State, Nigeria. So when I saw that you were talking about pounded yam repeatedly in the paper, I was attacked. No. What is the connection? And this video, I'm going to send it to my Ekiti people and my Ondo people that eat pounded yam morning, afternoon, night. What is the connection between pounded yam and osteoporosis?
Yeah, thank you very much. The connection is just basically diet. Paradigm itself is not harmful. As we all know, it's a good energy source. But
Mm.
carbohydrates is just it's essential carbohydrates has its own downside. Just as we all know, what the bone needs, what the nutrients the body needs for the bone health is mainly calcium and vitamin D. So carbohydrates, paradigm is low in those. Paradigm does not give those nutrients to the body. So it's basically carbohydrate. And now, in our study, we discovered that most of the participants they eat often. They times eat paradigm. morning. Some even say that sometimes they eat this morning, afternoon, evening, which you can see that this obviously that's not a balanced diet, obviously. So the carbohydrate alone cannot help because the body needs all the adequate diets. So when a particular diet is lacking, then we know that the diet is no longer adequate. So basically, the connection between eating polygyny and osteoporosis is that carbohydrates does not give is not a source for calcium and vitamin D basically. So that's a nutritional imbalance. That's the connection. Too many carbs. So that's the connection.
Okay, thank you. We've noted, we Ekiti and Ondo people have noted your research paper, Mr. Aroyehun. Because we don't eat pounded yam alone, we eat pounded yam with egusi, we eat pounded yam with okra. So we've noted your research paper, Mr. Aroyehun, and I'm sure everyone who eats pounded yam will note that it's a balanced diet. I mean, we know that they should eat a balanced diet. It's not really a causative factor for osteoporosis, but when you eat it breakfast, lunch, dinner, and everywhere you go to, you might predispose yourself to osteoporotic fractures. So to the next discussion, another author said results revealed that alcohol abuse is a predisposing factor to osteoporosis. Alcohol abuse, and I feel not even osteoporosis. So a large number of conditions and diseases, alcohol is a predisposing factor. How does alcohol intake lead to abuse, and which leads to, of course, osteoporosis?
Okay. Thank you very much for the question. Studies have shown that alcohol reduces calcium absorption in the gut, and you know that the bone needs calcium for a healthy bone. So that's true that that the person can become predisposed with alcohol abuse. Then secondly, I can say that it's okay. Studies have shown that alcohol also interferes with vitamin D metabolism, which the body needs for effective bone formation. So that also is the reason why it is the predisposing factor to osteoporosis. Because when you abuse alcohol, it can interfere with the vitamin D metabolism in the body. So we can also say that it also disrupts the bone hormone. Like it disrupts hormones that help to build it, like especially estrogen, for instance, in women. So alcohol abuse can disrupt such hormone in women. So and this affects like every drinking affects balance generally. So it can person might drink and become drunk and then fall and get a fracture. So that's also an indirect predisposing factor too. So I think that's the major ways in which alcohol is predisposing factor to osteoporosis, alcohol abuse.
Thank you so much for highlighting the intrinsic and extrinsic factors that makes that turns alcohol into alcohol abuse, which finally leads to osteoporosis, osteoporotic fractures. Mr. Aroyehun, all participants they reported that they use apps for the treatment whenever they were ill. Not just African, I'm not trying to look down on traditional medicine. I really value traditional medicine. Traditional medicine in the aspect of, because that's where a large number of our drugs are made from. You understand what the difference is with modern medicine is they are titrated, they are calculated, so you don't avoid, so you avoid drug interactions, or you avoid overdose. Now, and a large part of countries, even first world countries, they are trying to use herbal medications even in prescription to patients, to ill patients, but it's just that they are titrated in liquid form or stuff. Now, I want to go deep into my experiences, even in developed countries, in their use of herbal medication or traditional medicine. What I'm trying to say is, in Nigeria, for example, where this research was done, we call it agbo, and agbo is a condiment. Almost every Nigerian home has different bottles for the one for malaria, typhoid, whatsoever. and it will take a lot of advocacy and investment in health education and community engagement to get Nigerians of over 200 million people to throw away these bottles of agbo, let me put it that way, of different sorts of agbo. Now, reading this paper and you doing this research, you find out that people are on agbo, you understand? And when I read the paper, I was not surprised that people are using about condiment. That's the first thing that comes to mind. In fact, one of the last episodes we did on Dr. Fajembola's opinion, a nurse, a nurse had Ebola and he moved across 3 hospitals. Do you know the last place he went to? A traditional medical doctor, a nurse that works in a hospital. It was the case of Ebola in Uganda this year. The last place, last resort he went to was it. That's to show you that no matter how educated we are rooted to where we come from. You understand? Mr. Aroyehun, what advice do you have on this? Because all participants reported they use apps. It's not a surprise. A good number. If you ask me, I'm going to say at least 90% of Nigerians use agbo. Even people abroad, they ship agbo from Nigeria to UK, US, Germany. You understand? Singapore, in fact. What advice do you have on this in relation to osteoporosis?
Thank you very much for that question. Just as you have earlier said, most of the study that we carried out, most of the participants reported using apps, and it was not a surprising result because we know these people are this is a cultural thing. So it's apps, traditional app have cultural and historical value in Nigeria and even Africa setting as a whole. So, but the concern has to do with the scientific validation and even the medical standardization, the lack of standardization for it. So personally, um, when I'm trying to enlighten people about use of apps, I actually lay these 3 concerns that okay, these apps that you want to use, have you considered the hygiene? Where it is produced? Have you considered the preservative? How long can you preserve this? Have you considered the storage? So I feel most people need like even though we know this is something that we cannot really like 100%. I don't think 100% is possible to like put an end to use of apps because it's a cultural thing and it's historical thing already. So I feel health education we can see health education more on the fact that they need to be very careful with apps, especially when treating chronic disease like osteoporosis. Reliance on apps can be very, very, very fatal because at some point, if an individual is using apps for treatment and there's no any progress, the condition becomes worse even before any medical diagnosis or medical intervention. So I think um, even if apps want to be used as a complementary medicine, it should be under medical supervision. That's my own one advice I would say. And if at all you want to get app, you should consider one, the hygiene. You consider two, the dosage. Do you know the dosage of these particular apps? Do you know the kind of preservative that have been there? The storage. Those are the key things I feel we should consider before, as individuals, before you can even tell, okay, I want to use this app. If you have been able to validate this thing, probably you can consider it. If you have validated, okay, you are safe in all these considerations, then most importantly, if anyone wants to use an app which we know that complementary medicine, it should be under medical supervision. There should be medical, like okay, maybe a medical doctor approved that okay, you can use this as a complementary medicine to something. I know those instances are rare occasions. So that would be my advice. Yeah, and I think perhaps there should be more research and studies on evidence-based care and unverified apps. Like there should be more research on herbal remedies, so we can know the ones to like that is not safe and the one that is still safe for people to use. So I think if there are more researches on that one, so we can know that okay, some apps are safe or some are not safe. So we know what to preach to people regarding apps instead of just saying that you cannot use app at all. So if you have an alternative to them, even under that herbal remedies, I think we can actually sort it out and there can be a balance within among people that use herb, like talk about using herbs and then medical intervention too.
Thank you so much for elaborating extensively on that, for educating us extensively on that. I won't add more on any agbo discussion. The last question for you, Mr. Aroyehun. We focus on osteoporosis. What is the vision on pre-disease lifestyles in the next decade? What is your vision?
Well, my vision for this lifestyle that most individuals, if public health, if public health is very resourceful enough in the next few decades or next few years, I think early education on bone health in schools can help. When health education is integrated in, for instance, like the right from the undergraduate level, when people are aware of their bone health, I think that will prevent osteoporosis being a public health issue. But because this has to do with this has to do with lifestyle right from your younger age. So we don't have to wait till when an individual is 40-year-old or 50-year-old before we start educating them about their bone health. And then talking about the dietary awareness. So it's very important. People need to know that their diet has a lot of impact on their overall life eventually when they're aging. So balanced diet is important. They should be we should eat food that has enough calcium, rich in calcium and vitamin, which are very crucial for bone health and bone formation. So and again, in terms of I know the world has shifted to a I think we have the world has shifted to a phase whereby most people want to work remotely now. So I think sedentary lifestyle is more of the trend of the day now. So I think there should be proper public health education on sitting posture, on like this short breaks when walking, people can walk around. So those things are very important for the bone health generally. And then I think digital health can also be a way to bridge a gap between osteoporosis being a public health issue. And when people are aware, when people are, if you can make people aware of the consequence of their disease lifestyles, they will be very cautious of their lifestyles. So if people can be aware at the early stage that if you live social lifestyle, you are predisposed to this. I think they were very cautious and they can be very aware that okay, because one of the results from the study was that all the participants were not aware of the health implication of their lifestyles. So probably if they were aware, probably they might have lifestyle modifications which could have prevented them from being sufferers of osteoporosis. I say generally that's what I see. That's the next decade. I feel that public health can make an impact in terms of early education and then in terms of dietary awareness and increased physical activity at workplace. There should be breaks for exercises at workplace. People can walk around, so people can stretch and all that. I think those are things that are very important generally, and that's the shift I'm seeing in the next decade regarding these lifestyles of osteoporosis.
Thank you so much, Mr. Leon, for describing that excellently, behind beyond what I anticipated, and I'm sure our audience are benefiting greatly from the knowledge. I'm optimistic with platforms like this. We'll be able to do more health literacy, health advocacy, and with that, global citizens will be aware of pre-disease lifestyles. They should not engage in, and even if they have any medical condition, on how to contain, on how to cope it, on how to manage it effectively, so it doesn't worse, so they don't end up with any complications. So thank you once again, Mr. Aroyehun, for sharing your time, your expertise, your knowledge, everything with us on this episode of Dr. Fajembola'S Opinion. Global Citizens, we looked at Mr. Aroyehun and his team's publication on osteoporosis among women, especially in Akungba-Akoko, in Nigeria. And one thing with publications in any region, when I bring guest researchers like this, is when you look at whether it's in Bali in Indonesia, whether it's in Bangkok in Thailand, or it's Akungba-Akoko in Nigeria, as we just looked at. One thing is these regions are a picture of what's happening nationally most of the times, and what is happening at continent level most of the times, because what happens at local is what spreads, radiates to national and also global level. So global citizens, we looked at Mr. Aroyehun's paper. It's quite an easy paper to understand. Please go, read the paper, because health is wealth, prevention is better than cure. Please read the paper, share with your colleagues, and also this episode. Listen, watch, internalize, use it. That's it. If we are doing this and you don't use it for yourself, it's as if the work I'm doing is useless. It's as if the guest researchers, it's as if the knowledge I'm sharing with us is useless. The main thing is utilizing it for yourself. Utilizing it for yourself so that we reduce the global mobility and mortality, and we improve the well-being of everyone. So thank you so much for joining us on this episode, everyone. Have a blessed week, and don't forget each one help one. And Dr. Fajembola's opinion is a platform where research meets understanding, and I really hope you understood this paper to the best of our capacity. Thank you so much, and have a blessed week, everyone.
Thank you so much for having me. I'm honored.